Hi, this is Dr. John Heary, and today we're going to be talking about the thyroid. Thyroid disorders are very common in the United States, and they continue to increase year after year. And thyroid medications or thyroid hormones, especially Synthroid, they've been on the top 10 most prescribed meds for decades. Most thyroid conditions, they're typically not diagnosed in the early stage or the stage of the disease. And it's important you guys understand that every single cell in the body has thyroid receptor sites on it for those thyroid hormones. So if you lack ideal thyroid hormone levels, this can lead to a decline of cellular function in every single body system. All right, and that's why symptoms can be so varied when you have a dysfunctional thyroid. Now, the longer that you have a thyroid condition, that can lead to more loss of function and quality of life. The most common causes of thyroid dysfunction include hypothyroidism, which is a slower, lowered functioning thyroid, hyperthyroidism, which is an increased thyroid, a goiter, which is an enlarged thyroid, and then also thyroid cancer. It's estimated by the American Thyroid Association that over 20 million Americans are affected by thyroid disorders. And the thyroid gland, it's very susceptible and it's sensitive to imbalances in physiological systems of the body. It's also one of the most common sites for autoimmune disease attacks. If you have an autoimmune hypothyroid, it'll be diagnosed or it's termed or called Hashimoto's disease. If you have an autoimmune hyperthyroid, then that's known as Graves' disease. Now, Hashimoto's thyroiditis, it's considered the most common autoimmune disease in the United States. And Hashimoto's has also been found to be the cause of hypothyroidism in 90% of the cases in the United States. There's been extensive research done on thyroid conditions and also autoimmune thyroids. And one of the studies found that there's somewhere around like 7 to 8% of the people in the United States have antibodies against their thyroid. Now, thyroid antibodies, they've been found to be a marker for future thyroid disease. Unfortunately, many people have their thyroid destroyed year after year until they've lost enough thyroid tissue to be classified as a hypothyroid. Their symptoms, they'll tend to get worse as the thyroid is progressively destroyed. And what happens is then your metabolic rate, that's going to decrease, which will often lead to weight gain, increase in cholesterol, increase in LDL cholesterol, can lead to fatigue, depression, brain fog, gastrointestinal disorders, and it actually slows the motility down of food passing through your digestive system. And what's even more disheartening is that often the treatment is relegated to only thyroid hormone replacement. And unfortunately, their condition tends to worsen because nothing is done for the autoimmune condition. Many thyroid sufferers, they have weakened immune systems, even if they don't suffer from an autoimmune condition, and vice versa. Chronic immune conditions, they can also disrupt thyroid physiology. Some of these include hepatitis C, EBV, Epstein-Barr virus, right? Lyme disease, inflammatory bowel conditions, autoimmune diseases. So it's super important to support and restore the immune system back to normal activity in order to stop the progression of the thyroid disease. Now, there's many other causes for thyroid dysfunction. Some of the most common causes include nutritional deficiencies, hormone imbalances, often caused by birth control pills, HRT, hormone replacement therapy. Other causes include environmental disruptors, which can act as goitrogens. Goitrogens they're basically what they're substances that interfere with thyroid physiology. One nutrient that's important to the thyroid is iodine. Iodine is needed by the thyroid in order to make thyroid hormones. Environmental disruptors such as mercury, arsenic, nitrates, pesticides, etc., they compete with iodine, preventing the thyroid from making thyroid hormone, which leads to a hypothyroid or hypothyroid symptoms. One more cause of hypothyroidism or hyperthyroid symptoms that I'll briefly mention are medications. There's many medications that can disrupt thyroid physiology. Some of the most common ones include anti-inflammatory meds, antibiotics, antidepressants, diabetic drugs, high blood pressure meds, pain meds, antacids, and also cholesterol lowering drugs can also affect thyroid physiology. Many of these drugs may not necessarily have a direct effect on TSH, but they may affect the thyroid pathway, somewhere else, either upstream or downstream. And in functional medicine and functional nutrition, I'm always looking for the root cause of the disease, and it's my job to find out where the dysfunction is taking place. Once you find out where the problem is, then you can put a plan in place to fix the problem, start feeling better, and of course, regaining your health. So hope that was some good information for you guys today, and a place to start for you with thyroid dysfunction. So again, it was great talking to you guys, and I look forward to talking to you guys soon. All right, bye now.